My name is Claudia Wolf and I'm the owner of Wolf Therapeutic Community. I'm an accredited mental health social worker and I'm an accredited EMDR therapist. I am also an advanced resource therapist and resource therapy trainer. Resource therapy is an advanced parts work model that conceptualizes the personality as different parts. If you're an EMDR therapist, for example, you would know the importance of working with the correct part, the part that's holding the trauma, not the part that's saying what the therapist wants it to hear or the part that's intellectualizing. So resource therapy really helps us make sure that we are working with the right part at the right time in therapy, in processing, in EMDR protocols, and also that the client can access the existing parts of themselves, the healthy parts, the parts that they wish to be navigating, whatever their presenting issue is, day to day. They want the right part in place at the right time. If I had to compare resource therapy to another leading parts work model, whilst there's some differences, there's a lot of similarities with something like IFS, internal family systems. However, IFS is not particularly accessible either financially or waitlist wise for a majority of therapists. Resource therapy is a standalone modality, so you don't need to be trained in anything particularly to be able to become a resource therapist. You just need to be in a helping profession, caring profession, etc. However, it pairs beautifully with EMDR. So if you're already doing trauma work, resource therapy is just going to take it to the next level. Having a really, really good understanding of the theory of parts work, as well as a roadmap, which is what resource therapy provides. It's a roadmap for conceptualization as well as treatment. There is nothing that a client will bring to you with resource therapy under your belt that you will not know how to deal with. Which protocol is this? It's all laid out for you. It's obviously particularly good at filling the gaps. And again, I'm speaking in relation to EMDR therapists. But I'm sure other modalities have these issues where you get to a point where a client's really stuck, or you don't know what to do with what they've just given you. And whilst resource therapy allows for a lot of creativity and you bringing yourself as the clinician to the work, there is definitely a roadmap of things to follow that once you sort of master the individual skills or the individual steps of resource therapy, you can bring it to literally any other presentation. We all know that something like EMDR therapy is amazing for single incident trauma, and with the right skills and expertise, we can use standard EMDR with more complex trauma, developmental trauma, presentations like this. However, most of us are really understanding now that anytime we're talking about attachment work or really early life trauma, or anyone that works with bridging, it's just not as complete as we would like. So, I would go so far as to say that all EMDR therapists these days really need to have at least a base understanding of parts work, if not, a really good working relationship with parts work. Resource therapy is very beneficial with complex PTSD, but also, anxiety, depression, procrastination, burnout, chronic pain. These all, we're learning that these all have a really underlying trauma or underlying early life experience that is sort of showing up later in life in a lot of our clients. What I love about resource therapy is that it is so compassionate. It is so empowering. Your client already has all of the parts, all of the resources internally that they need to be able to navigate whatever challenges come their way. We don't need to rely on external resource figures. Don't get me wrong, I love using resource teams and things like that. But in RT, we really believe and we really help the client wake up the resources, the parts that are already within them that are very capable. I am able to use resource therapy in a very neuroaffirming way, in an identity affirming way. It is very, very adaptable to whatever client group or population that you are working with. In the foundation training, it is a 2-day training course, and you will learn the basics, enough of the RT protocols that you could run with it, that if you didn't have something like EMDR, if you're an occupational therapist, if you're an educator, if you're a general counselor, you will be able to immediately apply all of the things that you learn in the foundation, all of the practical skills. It's very experiential training right away, and to really great effect with any client group, regardless of whether they have a trauma history or not. If you are an EMDR therapist or you're very experienced with trauma therapy, you will also get so much out of this that you will be able to use at an even deeper level once you've completed the foundation. And for those of you that are like me, that need to take everything to the next level, after the 2-day foundation training, there's also an 8-day clinical to become a clinical resource therapist, and then you can go on and do your advanced and train the trainer as well. However, the foundation, honestly, it will get you so far. It will transform the way that you work. It will, for me at least, it just changed so much of how I felt about my work. Not only did I feel far more skilled and competent, but I also just enjoyed it, because there wasn't that feeling of like, this is so heavy, this is just so much, because it's a complete model to be able to work with in the moment. Whatever that client is bringing with you or bringing with them every week, they're coming in and going, oh, this happened, I was triggered by this, or this showed up for me, I was flooded by this. Straight away we can jump in with an RT protocol, bridge back and work with whatever the source of that resource becoming hurt, unhealthy, damaged, burdened, whatever language you use. You're able to do that processing on that level, and also find a resource, a part that client can bring to their day-to-day life to improve their quality of life phenomenally. Whilst I'm not teaching it, yes, I bring in a lot of the EMDR, BLS, things like that into my RT work. I really hope that you can join me at my foundation levels of training. I can come to you if you've got a clinic space, 6 or more clinicians, if you've got a beautiful meeting room or a space that's suitable for training. I'm more than happy to travel to Geelong or Melbourne, or if you have some therapist friends and you like to kind of nerd out over PD, again, like me, I can also set up personal training for sort of, ideally between 6 and 15 clinicians is a nice group. I also offer all of my trainings online.